Good afternoon, everyone watching online here in the Philippines and worldwide. Welcome to the Development Academy of the Philippines Public Sector Productivity Webisodes. My name is Gerard Calambro, and I will be your moderator for this afternoon session. Let me introduce our co-moderator, Mr. Enzo Ereñeta. Good afternoon, Sir Enzo.
Good afternoon, Sir Gerard, and to all of our viewers from the participating agencies, namely Privatization and Management Office, Makati City, Philippine Information Agency, Quezon City, the local government unit of the City of San Fernando, Pampanga, Philippine National Police Academy, Department of Education, Cagayan de Oro City, Department of Finance, Department of Health, Tayuman, Manila, Cultural Center of the Philippines, Office of the Ombudsman, Philippine Business Center, Maramag, Bukidnon, Philippine Ports Authority, and many more.
Here at the Development Academy of the Philippines, we believe that we play a vital role in nation building by helping accelerate the transformation of people and organizations. As an effort to stay relevant, we are conducting this webinar series on knowledge management to serve as a venue for learning the different tools and frameworks that contribute to policy and program formulation.
From day one, we had a lecture discussion on the principles and processes of knowledge management in the public sector. On day two, we highlighted how knowledge management is practiced in the public sector. Now, this afternoon, we have a sharing session on the knowledge management experience of the Philippine Department of Health in the new normal.
So our speaker is a director from the Department of Health's Knowledge Management and Information Technology Service. He is a physician by profession and has held key positions in the Department of Health in the past 30 years. He has focused his career in public health, particularly in infectious diseases, epidemiology, health promotion, health systems, and universal health care. He has acted the OIC Assistant Secretary of the Department of Health from the same agency in the year 2010 to 2015. He continues to earn accolades for exemplary public service, notably from the Gawad Career Executive Service Award in 2017 and Most Outstanding Alumnus for Public Service during the 50th year anniversary of his alma mater, the University of the East Ramon Magsaysay Memorial Medical Center in 2007. He has published several scientific articles in infectious diseases and is a much sought-after speaker in numerous topics in medicine and public health. He remains popular in media even after his assignment as the DOH spokesperson from the year 2005 to 2015. He remains a TV host from TTV4's weekend medical program, The Doctor is In. He remains affiliated with various non-governmental associations, such as the Philippine Medical Association, the Philippine Society for Microbiology and Infectious Diseases, the Philippine Foundation for Vaccination, South Asia Field Epidemiology and Technology Network, and the Rotary Club of Manila 101 of Rotary District 3810, which he currently serves as one of the assistant governors. He is dubbed the DOH Dancing Doctor because of his penchant for dancing in public as he espouses a healthy lifestyle and disease prevention. Let us all welcome Dr. Enrique A. Tayag. Good afternoon, Doc Tayag.
Thank you, Gerard, for the introduction. Hello, everyone. Okay, thank you for joining this webisode, the third day. And I'd like to thank the organizers, especially the Center of Excellence on Public Sector Productivity. The topic for today is the pandemic reboot of knowledge management in the public health sector. Let's start. Think about this. Where is the wisdom we have lost in knowledge? Where is the knowledge we have lost in information? The Centers for Disease Control added this one. Where's the information we have lost in data? Knowledge management is just like an iceberg. We know certain things. The uncertainty below the iceberg is something we have to dig or find out later. This is not so obvious to many of us, but there are ways how to fathom how deep the iceberg is. What we know and what we practice, and in between is a chasm. A chasm because what we know is not something what we practice. In fact, there were several studies that showed for research, for example, that have been published, it takes many years before the recommendations were actually implemented. And this is going to be a problem because out there are so many researches that have been published, and we have no time to read them all. And so, in the last few decades, to consolidate the results of the scientific studies, for example, we were introduced to terms like meta analysis. There are those among us who are able to consolidate and analyze data from different sources. But we don't have the same facility as these experts. Or are they really experts? Conventionally, when we consolidate data, there are structures and procedures, and the goal is to contribute to new knowledge. But what is new knowledge? In this slide, we show you several terms. Do you or do we really thoroughly understand all of them? Let's start with pandemic. Flattening the curve. Hammer and dance. Swiss cheese model. Social distancing. Contact tracing. Community quarantine. Border control. Telemedicine. Work from home. Herd immunity. Variants. And they are all vying for the word of the year, perhaps. But do we really understand them, the concepts behind them? Let's start with a pandemic. A pandemic is a global outbreak or epidemic. But what is an epidemic? It is an unusual episode of the spread of infectious diseases more than the usual occurrence that have been observed. So when we talk about pandemic, it has extended beyond a continent. That's what many would agree on this term. It's a global outbreak. Many countries would have been hosts for a certain virus, and this time it's the SARS-CoV-2, so we have a pandemic. Did you know that we have an ongoing HIV/AIDS pandemic? Flattening the curve. So what's a flattening the curve? In infectious diseases, this concept explains a curve, the peak of incidence of a particular infectious disease. It goes up, but ultimately it will go down. It can go down naturally without intervention, or there should be interventions before it goes down. Now, flattening the curve in this pandemic is an important concept. Epidemiologically, flattening the curve means that we have to slow down the transmission of this virus. When we're able to slow it down, the consequence is that our health capacity is relaxed. Okay? Our doctors and nurses can rest. The hospitals will be able to prepare itself again when more cases come back. So flattening the curve is like this. If everyone goes, for example, to the comfort rooms all at once, then all stalls will be taken and nobody can use them. But if we limit those who actually use them, then we will have comfortable space. So that's flattening the curve. But have we really flattened the curve? That is the pandemic in our country. Hammer and dance. Tomas Pueyo, a Spaniard, gained fame with millions of followers, and his hammer and dance fury has become viral since last year. He's not a public health expert, but he explained it in two articles what a hammer and dance is. So, hammer is making sure the virus does not spread everywhere and anywhere. We're able to contain it. Hammer is the containment part or the containment phase for making sure that we get rid of the SARS-CoV-2 virus as fast as we can. But that's not happening. And for many countries that have implemented hammer strategies, they were able to ease on their economic activity. And this is the dance. But dance doesn't mean doing nothing. It means that we have to continue with our health protocols. Do you have your mask? Are they readily available when you go out? Then there's the Swiss cheese model. Over many months, because of the experience shared by experts and non-experts alike, we were able to discover for ourselves, sometimes with guidance from public health authorities, that a particular behavior carries a higher risk compared to another behavior. For example, for the transmission of this particular virus, the SARS-CoV-2, talking out loud or singing carries a higher risk in people who don't wear masks and in an indoor setting with nary a ventilation. This is the reason why many interventions cannot work alone or separately from others. Please don't get tired when we always remind you that stay home if you don't feel well, stay home if you think you've been exposed. Don't just leave homes if it is a non-essential activity you're going to participate in. Avoid crowds. Make sure you distance yourselves more than 3 feet away from another person while wearing your mask or face shields. There are many of us who will argue what's the utility of face shields, but that's the health protocol procedures right now. You may argue that when you see other people from other countries only wearing masks minus the face shields, what's happening here? The Swiss cheese model not only subscribes to these health protocols, it also subscribes to quarantine, isolation, testing, contact tracing. So let's go with quarantine. What's the difference between quarantine and isolation? They're not the same. Just remember this. You quarantine the exposed. You observe them. And if any of them got really exposed, then the symptoms or illness will incubate. The incubation period right now, on average, is 5 days after exposure. And you're going to have symptoms like fever, cough, difficulty breathing, loss of smell. And then you find yourselves waiting for complications from SARS-CoV-2. And there's more. You may have been exposed and not present with symptoms. You may be one of the asymptomatics. That's what makes our understanding of the SARS-CoV-2 very difficult to comprehend because of the uncertainty. Now, when we look at vaccination and government is ramping out our vaccination deployment, and we have at least 6 vaccines with emergency use listing. And if we combine this with the health protocols, that's a Swiss cheese model. Swiss cheese have holes around it, so the virus will not be able to spread if we all use these interventions. but it should be used consistently. Will it work? How about social distancing? For many months now, it's really difficult to explain social distancing, especially when it was literally translated into physical distancing, as if you can actually measure 3 feet or more, the distance, a safe distance between you and another person. It is not something that can be complied with practically. You just hope that you're far away, but in a crowded situation, forget the physical distance because it's not going to happen. Social distancing, in its proper context, should change our mindset. It means like this. When you leave your homes, you don't worry that you may get infected from another person. The mindset is that you may be the infected one and that you may spread it to others. This is an important mindset for social distancing. It's avoiding the crowds because not because you don't want to get infected. You're avoiding the crowds because you may infect them. That's why before we leave our homes, we ask ourselves, I am well. Can I check my temperature? Do I have cough? And if there is any suspicion that you have been exposed, then you start quarantine. Let's go to contact tracing. What is contact tracing? When we identify those possibly exposed and we quarantine them, we are having a successful intervention so that the virus will not spread beyond ourselves. And so you were introduced to a term like R0 or the reproductive number. Infectious diseases, based on studies about them, will have different R0. For the original strain of the SARS-CoV-2, a person can infect another two persons, that 1:2. The appearance or discovery of variants changed the equation. There are variants wherein the R0 has doubled. For example, the variant now named the Alpha variant has an R0 in which a person who's infected can actually spread it to 3 or 5 people more. And Delta variant will have one person who's infected to spread it to 8 other people. Now, you may ask yourselves, 1:2 and 1:8, that's not much. Why should I worry? Well, if you have your pens and papers or your calculators or whatever gadget, you can check it yourselves. In 5 generations, an R0 wherein an infected person infects another 2 persons will end up with 32 persons getting infected. But the Delta variant, starting with just one infected person and assuming that the others do not know that they have been infected, after 5 generations, there will be over 32,000. So 32 and 32,000, that's 1,000 times more in terms of transmissibility. Now, let's just look at community quarantine, the CQs. Community quarantine. You actually quarantine people, individuals. But community quarantine, think about it. Exactly what is community quarantine? This was introduced to guide us so that we can have specific behaviors that allow us to reduce the spread of the virus. It will be very difficult if each one of the million of Filipinos we get a letter from government telling them what kind of quarantine is appropriate for you. And so there's community quarantine. But there has been confusion. The ECQ now is different from the ECQ introduced last year. And then the ECQs will be different for other areas as well. And that's why it's very important that knowledge management enters into the picture so that we can learn its concept and find out for ourselves if the choices we make are actually knowledge or only some thoughts that don't hold water. Border control. The International Health Regulations of 2005 that revised the 1969 regulations. And if you read it, it's a legal instrument among many countries, actually excludes border control to halt the spread of any virus or contagion. Because the new mindset is to control it at the source and not to watch for them at our borders. But right now, there are travel restrictions and there are border procedures, hoping that we catch the virus early in individuals who may have been infected. But it doesn't work out that way. Telemedicine. The Department of Health has introduced telemedicine, and many provide telemedicine services, and they are using different platforms. We have issued guidelines to make sure that telemedicine will prevent you from getting scammed, or if there is any fraud, or that you will have better personal experience. How about work from home? Is work from home for everyone? How can you work from home if your internet connection is not stable? Herd immunity. Suddenly, the term many those in the public health profession would actually understand so easily is something that the public has to grapple with. What is herd immunity, especially if the numbers change from time to time? Think of it this way. The virus spreads because there are susceptible persons or people. Susceptible persons means that they can get infected. So all of us were considered susceptible people, and we can get infected anytime. The virus doesn't choose who among us will be infected. In public health, when one gets an infection, they develop enough antibodies so that a repeat infection may not happen again. But in SARS-CoV-2, in a few cases, it does happen. But for many of us who get the COVID-19 infection, we are protected, but only for some time. We are not expecting that it will be a lifelong protection. Another way of protecting ourselves from infection is getting the vaccine. But the current vaccines work in different ways. It can actually prevent transmission or we don't get infected. Or the vaccine is just capable of making sure that if we're infected, we will not land in hospitals or needing ICU services. Or deaths will be fewer if we are vaccinated, or even no deaths. So when we say herd immunity, when you combine the number of those who won't get sick, either because they were infected already or they got vaccinated, the remaining people around us who were not vaccinated for some reason will be protected as well, as if they were given the vaccination, as if they already got the infection. So that's herd immunity. And there's a computation for doing that. Early in the pandemic, the herd immunity was placed at 70%. Now, that is kind of shaky because of the Delta variant. Some say you should reach at least 85%. The variants. The WHO decided to have categories of variants. They don't want to call it mutants, but they start with mutations because the SARS-CoV-2 virus mutates just like any virus, and it mutates in different ways. So we have variants of concern, variants of interest. Variants of concern, the WHO says this variant has been found when it has spread in population that it's easily transmissible, many more people get sicker, or there may be deaths, or the vaccines that we have do not protect us from it anymore. So those are the variants. I got this from a blog from the Asian Development Bank. It says, the pandemic showed us that an organization is only as effective and a country and its people only as prepared as the knowledge they harness and share. There are three components that this happens: learning from the past and the future, leveraging digitalization, breaking silos, and enabling multidisciplinary problem solving. Surprise! There's an article, and you can check out the reference. We did not learn from the two prior epidemics of coronavirus, and were ill prepared to deal with the challenges the COVID-19 epidemic or pandemic has posed. In the beginning, with the Department of Health, long time ago, 2 decades, when we had our reengineering and organizational downsizing, we took to task what changes should we have in the Department of Health. Suddenly, there was an opportunity in 2002 or 2002, courtesy of the Development Academy of the Philippines, a workshop on knowledge management. We got serious about this. And with the help of the World Health Organization, we were able to come up with a framework for our knowledge management. Our vision then was making knowledge work for a healthy nation. The mission: foster a culture of knowledge management in the health system. Between 2005 and 2006, there were several issuances that allowed us to operationalize everything we have planned for in 2007. I'm sharing you the framework. It's knowledge acquisition. We gather data that's actually translated to knowledge, or we produce the knowledge. There's innovation for knowledge, and we use knowledge. Let me give examples. In this pandemic, for example, because of the restrictions in-person interactions, e-learning platforms became our default. This is the knowledge management acquisition during pandemic in the Department of Health. I didn't call it a problem, a discrepancy between what is desired and what we have. It's not a solution, it's a countermeasure to address the discrepancy. So will the e-learning platform that address training needs address the restrictions in in-person interactions? Why don't you try it? I invite you to visit our website and see our e-learning platform in the DOH Academy. This is free knowledge for you. How about knowledge production during pandemic? Policymakers, those who make decisions every day to respond to the COVID-19 pandemic, will always demand data which is inadequate. And one of the data that's inadequate is the data on our health capacity. Are we ready? Are we prepared? Do we have enough beds? How about oxygen? How about the ICUs? How about hospital stuff? Do we need more? So our countermeasure is that we develop in-house a data collect apps. With this, we're able to monitor certain indicators or metrics and show it in a dashboard that allows managers, policymakers, or even you who have tried this so that you can learn timely distribution of beds, ICUs, PPEs, name them, and this will give you a hint if we are overwhelming our health capacity. Innovation. So I told you about telemedicine, and there was a time that I was a call center agent and also provided telemedicine services. It's the DOH COVID-19 hotline 1555. The disruption of medical services push us to innovate, and telemedicine is one of them. And we are lucky because there are telemedicine partners that are supporting our program so that telemedicine becomes the norm in the next few months. So if you worry about your symptoms, is it the Delta variant? Is it non-COVID? Is my fever leptospirosis or is it COVID? You want to go to hospital, don't want to go shopping for hospital, then please call 1555 and wait for your turn. How about knowledge management sharing? So at the Knowledge Management Information Technology Service, I want to share with you our practice wherein we have our daily huddle, that's virtual. It's for 15 minutes. The designated host will close the conversation at exactly 9 a.m. We talk about many topics that improve our knowledge on certain specific things. It can affect our operations, for example. It can affect the way we would respond to the pandemic or more information about the virus. That's not all. Knowledge management sharing is not only within our office. We have to share it to the public. When fake news blurs science, we have now a deluge of webinars, just like this one that's happening this afternoon. It's a very good way of sending the message to many people all at once. Another sharing during pandemic is when the COVID response is fragmented. So the IATF resolutions is a conglomeration of many agencies, experts who view data, make an analysis, give recommendations, okay, down to the grassroots levels for every activity. And you can check this out in our website if you need to know these resolutions. And of course, it's not only confined to our borders. We share information to our neighbors, especially here in the ASEAN region. The knowledge strategy is defined as a goal in terms of knowledge resources, the plans about how to achieve, manage, and deliver these resources, and the internal, external resources and structures that the company will need. And so it is important that we change our strategy from knowledge exploitation to knowledge exploration. If we do things the way we do before to address our discrepancies, we will fail. We have to explore. Okay? We have to think out of the box. Or better, we think collectively and change the way things are, but not how we thought it to be. And we can do research. For example, who actually benefits when we work from home? Do we have answers for these? Let's do this step by step. We should have a cadre of technical experts that know knowledge management so well that we'll be able to establish networks, knowledge repositories, and harmonize all there is out there. And I'll end with this. Finago's three laws on information. The information we have is not what we want. The information we want is not what we need. The information we need is not what we have. So what is our knowledge? If at first we don't succeed, put a stop there and now ask ourselves, why am I here? Maybe we should spend time alone and ask ourselves questions and silently wait for answers. Thank you so much. That ends my presentation.
All right, thank you very much, Doc Tayag, for that wonderful and informative sharing session on the DOH experience in knowledge management, especially in the new normal. So we'll read some questions from our audience. First question is from Maria Lourdes Mendoza. She's asking, should we promote work from home for jobs which allow the delivery of service without physical presence in the workplace in order to help flatten the curve?
There are recommendations from the civil service. The goal is to reduce the risks of spreading the virus. But please remember, even in our homes, we cannot prevent the spread of the virus if we are not too cautious. So while the goal is to prevent spread, because where people gather, then there is an increased risk for transmission. It will better serve us if the work from home is based on another paradigm. It's your business continuity plan. So you should have business continuity plans so that you can actually identify how we can benefit from work from home. It is not for everyone. And please don't randomly choose your personnel who should go work from home if they're not supported. Do they have internet connection? Do they have gadgets? What are their tasks? How will they report it? Because work from home means there should be no distractions from us. And that's why work from home should be very carefully planned and make sure we're able to measure performance. In government, work from home is difficult to monitor.
Thank you for that, sir. Our next question comes from Janelle Bertudan. She asks, how can an employee be able to effectively work at home, especially in health services, if there are restrictions on bringing documents at home or outside the office or premises? I think Dr. Tayag already answered that part in his first answer. So she also has a second part to her question. She asks, what are the risks of working from home in terms of knowledge management in the health sector?
You isolate yourselves from the other groups in the office. And if you do not interact and you're only working on a specific task, work from home, it doesn't make sense. Work from home doesn't mean that you have these assigned tasks, but you're not going to have that connection with your other office workmates. It's very important that you interact with them. We need connection. Even if you work at home, you will need the support or technical guidance of others. And work from home does not exempt you from working with others. You work with them while you are working from home.
We also have another question from Christian Nobleza and Estrella Pahalia from the Department of Labor and Employment. There is a notion with misinformation regarding the benefits of vaccines, and how can the government neutralize these wrong notions and regain the confidence of the people in taking the vaccine? So I think with the advent of social media and fake news, so what can we do to neutralize wrong knowledge or fake news in promotion of the benefits of vaccines?
I wish there was a formula. We all struggle. Just recently, there was an announcement that vaccines don't work. And if you believe they don't work, even though we bombard you with hourly news that it works, you won't. There's confirmation bias. It starts what you believe. So, even if I say that you get vaccinated, I tell you a story, I got vaccinated, I didn't have side effects, and still you believe that it's not true, even if we consume many hours explaining to you how vaccine works, you just won't budge. So one of those that influence your beliefs are the social media postings, and you don't know if they are fake news, they're true. So what I can advise you is to get professional advice. But who is a professional? Even a professional can make mistakes. So what will save us from all this fake news is that we have a high level of science literacy. If you don't have the science literacy, please, please don't speak about these concepts. You will just confuse people. And if you don't have the science literacy, please start now educating yourself. Read books that are reputable. Get information from reputable sources because it's scary that our science literacy is not looking good. Because if you don't know the science, then you can just blubber anything that you've read, and harmfully, you share it to others who don't have any clues. And that's the difficulty we are facing now. And we hope you help us make sure that we are all science literate.
Our next question comes from Romel Asuncion. They ask, what knowledge management policies are needed to strengthen the security of information and data in telemedicine and other e-health technologies?
We can always use technology to make sure these personal information are secure. But it all starts with us. So if we don't know how to protect our data, how we can safeguard ourselves from encroaches to our data, it starts with us really. So it's difficult that you assign the responsibility to other people or to government when you or we ourselves are not very serious or cautious about this. For telemedicine, we have certain procedures
Did
that
you encounter challenges in the knowledge management committee of the DOH whenever there is a change in leadership? So how do you overcome these challenges?
okay, the challenges with any change of leadership, not only with the department, because we have to align with the new directions of our new leaders. If we are not able to align ourselves, meaning your personal mission, with the mission of the agency and its new leader, then there will be friction, and this will affect our creative performance. So it's very important that this is managed. Now that the elections are near, and we're anticipating there's going to be change in leadership, we must prepare. There can be a transition plan. We should prepare so that our priorities remain priorities. We should prepare so that the impact of a change in leadership is something that is manageable and something that we can live with in the next 6 years.
Thank you for that, sir. Our next question comes from Alma May Agne. She asks, in your experience at the DOH, how does knowledge management support your business processes? And she also asks, how did DOH make the adoption of knowledge management possible at the agency level?
We were guided by the Development Academy of the Philippines. We were guided by our mentors. And when we were left alone, we stumbled, we got up, others forgot. There's a new generation of employees at the Department of Health. We have to start again. And that's why, so that everybody remembers, my office is the Knowledge Management and Information Technology Service. Those are bragging rights. But we have to leave our knowledge management. It's not going to be very easy. And that's why conversations, dialogues are important. And we have missed the opportunity to get the accumulated knowledge from our retirees. Their experience is so critical that even our documents will not compare to their experience. So we are now embarking in a new way of how we will consolidate the experience of our retirees, because somehow there is something there that can make generations profit from their knowledge.
All right, so very well said, Doc Eric. And last question from Amelin Tagle. What can knowledge management tool can you suggest to convince people or campaign in order for them to get vaccinated, especially the senior citizens?
We have the information. We can appeal to their emotions. If trust in government is there because it wavers from day to day, if there is, if we say, if we do what we say, that you're going to get your vaccine, so there are things we must do. We make sure there are vaccines available for everyone. Number two, that we make sure when you get vaccination, it's not something that's going to be messy, that you're crowded, that you're not comfortable, that you're taken care of. And make sure you're not the only one who gets vaccinated. All the household members gets vaccinated, your friends. And make sure that if there's something you feel after vaccination, you're also taken care of. Remove from your mind scary thoughts, and there is someone you can talk to about this before vaccination, during vaccination, after vaccination, then just maybe we will all get vaccinated. If it's not coming soon, then we just hope and pray it does.
All right, so that's the only time we have for this webinar session. We would like to thank Doc Tayag for sharing the knowledge management experience of the Department of Health in this afternoon session. To all of our participants, please be reminded that in order for you to receive the certificate of attendance, you must attend all of the 3 episodes and submit the daily evaluation form in our Google form to be given later on in the chat box.
Because I can read your mind. Dr. Tayang, which is the best vaccine?
Yes,
Okay,
sir.
get your pens. I'm going to announce it. This is only exclusive for you. The best vaccine is the one you got in your arm twice. Thank
That's
you so
right.
much.
Again, another quotable quote from Doc Eric. So the best vaccine is the one accessible to you right now. And if you complete the 2-shot regimen, if it's a 2-shot regimen.
Thank you again, Dr. Tayag.
All right. So on behalf of the Academy, I would like to thank Doc Eric again for sharing his expertise during the session, and to all of our participants who learned a lot in this webinar series. And we hope to see you again next month for our new webinar series that we will announce in our Facebook page. So see you.
Gerard,
Yes, sir.
kung walang knowledge, walang power.
Sabi nga
Ayan.
ni Ernie Baron.
Ernie Baron.
Yes, sir. So we hope to see you again on the next session of the PSP webinars. Good afternoon, everyone.